America's most popular game show host is getting an outpouring of support after announcing his diagnosis of stage 4 pancreatic cancer. Alex Trebek says he plans to beat the disease, but he knows it will be an uphill battle. Tonight, News 3's Darius Johnson spoke exclusively to a cancer surgeon at Memorial Hospital to learn more about this devastating medical condition.
Tina, pancreatic cancer is the third leading cause of death, and one of the reasons is because many don't know they have it until it's in the later stages, and that makes it more difficult to treat. Alex Trebek announcing news that left many in shock and sadness. He has stage 4 pancreatic cancer. According to the American Cancer Society, the disease has a 5-year survival rate of 9%. Experts say more than 90% of people diagnosed die from it.
The disease is pretty devastating, as you mentioned, and those patients that are found earlier will have a better chance of beating than if they're found later.
Some of the biggest risk factors include smoking, alcohol abuse, and if there is a history of pancreatitis within your family. Dr. Christopher Sinkowski at Memorial Health says the stage that the disease is in is most important because that will determine how it is treated.
Most cancers are staged from 1 to 4, 1 being earliest, 4 being latest. 4 typically means for most cancers that the cancer has spread from the initial site to somewhere else.
He says there is not much a surgeon can do at that point, but chemotherapy is an option. One reason the disease is so deadly is because in some cases there are no symptoms, particularly in the early stage. Once symptoms do show up, it means the cancer has progressed.
Difficult to sort of say, well, how do I know if I have pancreatic cancer early or not? There are situations where the bile duct will get blocked and these patients will turn yellow and they get jaundiced.
Sinkowski says the main goal is to increase the chances of survival and improve the quality of life, no matter what stage a patient is in. And for those diagnosed early on, treatment usually includes surgery, radiation, or chemotherapy. Dr. Sinkowski says if a patient is facing the diagnosis, they should find the right doctor and take it one step at a time. Darius Johnson, WSAV News 3.